knocked out tooth. This is the season we see a lot of children with dental fractures and knocked out teeth. Dental injuries to the teeth commonly occur with falls, assaults, sports activities, child abuse, and multiple trauma, such as an auto collision. Toothache and jaw pain are common symptoms of dental injuries. Some people may complain of pain with chewing or with temperature changes. Although a tooth may have broken off, loosened, fallen out, or been pushed into the gum line, other less common symptoms may be seen. Isolated bleeding from the mouth, cuts surrounding the lips and cheeks, facial swelling. A change in the tooth's color may take a long time to appear. If a tooth is completely knocked out, it should be quickly rinsed off with water, but never scrubbed. The tooth should be held by the crown top, not the root, so you do not damage the ligaments. In a cooperative adult, the tooth should be put back in the socket. Many people may be uncomfortable reimplanting the tooth on their own. If this is the case, be sure to transport the tooth to the doctor or dentist in saline, salt and water, milk, or saliva. You may also place the tooth between the cheek and gum line of either the person who lost the tooth or any willing adult. The mouth is the best place for the tooth because it protects the root by keeping it moist and providing protection against bacteria. Do not transport the tooth dry. This will cause damage within minutes. Transporting the tooth in water is also not recommended. In children or uncooperative adults, the tooth ideally should be placed in milk or saliva. An uncooperative adult or child may swallow the tooth. Of greater concern, the person may inhale it, causing a choking episode. If bleeding from the socket is seen, rinse the mouth out with water. Place a wad of tissue or gauze on the socket and bite down on it. The pressure exerted will usually stop the bleeding. For loosened, pushed in, or broken teeth, avoid eating or drinking anything. If the tooth is broken into pieces, retrieve any remaining parts and transport them to one of the suggested solutions. For teeth that are just loose in their socket, treatment is simple. Avoid hard foods. Teeth with significant motion will need to be stabilized using wire, metal arch bars, or a plastic bond for 10 to 14 days. For knocked out permanent teeth, the sooner the tooth is put back in its socket, the better its chances. The best chance for survival occurs if the tooth is reimplanted within 30 minutes. Once implanted, the tooth must be stabilized using the techniques just described for 2 to 4 weeks. Prevention. Wear a mouth guard when playing any contact sport. Avoid fights. Avoid hard foods such as bones, stale bread, and tough bagels. Always wear a seatbelt. If in doubt about anything, please consult your dental care provider. Dr. Charlene Reed is a graduate of the University of Havana's dental faculty. She works at Easy Dental Care with offices in Grand Bahama, Nassau, and Exuma. She is a member of the American Dental Association and the Bahamas Dental Association. If you have any questions, she can be contacted by email office@myeasydentalcare.com or at 60-278-44 or 45.